So that's basically it in a summary, in a nutshell, trying to keep within your time frames. I will entertain any questions and we can go from there.
Are these services available to anybody or only if they're covered by Medicaid?
Okay. So because we are a federal and state funded agency, we provide services to all indigent people, including those who do not have Medicaid.
Okay. And is there ever a time where someone's denied this type of service, say they're, I don't know if this happens, but that they have private health insurance, and does that ever happen? That someone would be denied it because of their insurance status?
Possibly only if, in fact, the private insurance company agreed to cover the service for that individual. What we're finding is that very few private insurance companies are willing to provide coverage for the Vivitrol shot because it is $1,200 per injection.
Okay.
And insurance companies are denying a lot of our claims, which is then we turn them over and apply that Vivitrol injection through the state funding.
Okay. That's what I was trying to get clear. I had heard, I guess, nationally that it wasn't really covered by insurance. So I was wondering if there's ever a time that someone doesn't get it, but they would still get.
They would still get services from
Yes.
Family Guidance Centers, correct? Yeah, there's a national push to try to get private insurance companies to pay for more of these medication-assisted treatment. There's laws in Illinois under certain circumstances that do require private insurance, but of the 3,000 patients we have, about 90% do not have private insurance. So we're seeing most of the indigent people.
Your conclusion statistics. Why, I'm just curious, did the one at the ADF refuse the service? Out of all the people that was given, you have here that only one refused in the top box.
I think there was actually a few more than one.
You have,
Yeah, there was.
10, okay.
Yeah.
Okay.
So
10.
So before, so their court, they may receive a court order to participate in the Vivitrol program, and again, without going into great detail, prior to us doing an injection, we provide some education. That we have a nurse at the jail on Saturday morning who provides education to these patients about what Vivitrol is, what they're getting into, what the expectations are. Some of those individuals just felt that they did not want to participate in the program because there's an expectation that once you leave jail, you'll continue in treatment. And some of those individuals didn't want to do it. The other thing is that, as with anything else, I'm sure they found out some information from other inmates or other friends of theirs that, oh, this doesn't work, or this is not something you want to do, and I want to do something different. So, you know, mostly it's based on misinformation.
But it did say since July 1, so I was right about the one.
Oh yeah, you got the one right.
Thank you. I know I thought.
Okay, thank you.
Rich and I, we have some of the deputies from ADF. Can we understand how this works in the ADF,
Sure.
the procedure and stuff? So maybe between
Sure.
both of you, we can.
If anyone will.
Sure, you're
Any
welcome.
of the deputies?
Morning.
How are you?
The Deputy Chief Dave Adams, with the Sheriff's Office. Assigned to ADF. If you have any questions, I'd be glad to answer them for you.
So how does it, my main question is, how does this work? What is the participation from your staff? What do they have to do, and what does Family Services have to do if we're administering this in the jail?
So the Sheriff's Department acknowledges that we have an opioid crisis within the country and also within Will County. So this is almost no cost to the County of Will to administer this program. There are costs. It's just the staff, the logistics of the program. So we arranged prior to this program being implemented. One of the limitations we have within the facility is an area to actually conduct the program, because there's injections, doctors, private interviews, things like that have to take place. They can't be just done anywhere. So we do it in a medical clinic portion of the facility, but throughout the week, that medical clinic is being utilized by nursing staff, mental health, dental, all sorts of other services that we provide. So the time that that's available has been, we determined Saturdays would work. It was originally set up from 8 to noon. And so that's what we were doing on Saturdays, which required us to hire back a deputy to cover that program because we had no extra deputies on those days to administer the program. And then we've actually just recently agreed with Ron and Judge Policandriotis to extend that program if there are more people that want to participate from 8 to 4 p.m. on Saturday. So that would actually require an additional hire back. So as far as cost for the sheriff's office, that's all I can really think of is the overtime for the deputies to be there to facilitate it.
And how much overtime is that over the course of a week, year, or whatever?
So it's 1 day per week. It's 1 deputy. So 8 hours at a time and a half, or whatever rate that deputy earns. And then now that we've extended the program, and I think it's only been 1 week because of the holiday weekend, we didn't have it that Saturday. So that first weekend, I don't even know if we went past noon that first. So actually, it hasn't cost us anything yet for the extended hours, but it will be an additional hire back for approximately 4 hours. That's per week. It's been working. And we're glad if we can help and use the state's money instead of Will County money. We're glad to do that as well.
Yeah.
I'm just thinking in context of, we are going to get a presentation in the next month or two about adding some people. If there's a way that once we add some people to your staff, that doesn't become overtime, it somehow becomes part of it.
Absolutely, more people would certainly help. And sometimes I think folks might get the impression that we're trying to be difficult when we say we don't have availability to do these programs or to do this or to do that. And really, we know that we have to answer for the overtime at some point, and so we're trying to explain that to other entities. Hey, we'd like to help you, but we have no way to pay for it. Matter of fact, I asked if there was a way for the sheriff's office to get a slice of that grant money to pay for the overtime, and I was told that wasn't possible. I don't know the details of the grant, but we did approach that as an option. So yeah, we will do a presentation coming up here about staffing, and more people means less overtime, that's for sure.
Okay. Good.
Anyone else? Questions for the deputies?
Thank you.
Thanks.
Any other questions for Ron?
Thanks,
for coming.
appreciate it.
Thank you.
Any other new business? on the committee? Public comment, any public comment? Public comment. Okay. One third time? Okay, no public comment. I have no report from Darren, and we do not need an executive session. Can I get a motion to adjourn? All in favor? Aye. Okay, stand adjourned.